Hello, I'm Dr. Anthony Colantonio for We Do Patients Right, and I'm here to provide you with some information on cancer screening that just might save your life or the life of your loved ones. First, let's discuss some cancer myths and immediately try to dispel some cancer falsehoods. There's a lot of misleading information out there thanks to repeated rumors and studies that get disproven. Myth number 1. Dark-skinned people don't get skin cancer. The reality is that darker-skinned people, including African Americans and Hispanics, can and do get skin cancer. In fact, the rate of melanoma, the deadliest type of skin cancer, has increased among Hispanics by almost 29% since 1992. So, skin color is no excuse for skipping sun safety. You can protect your skin by wearing sunscreen, seeking shade when possible, wearing sun protective clothing, avoiding tanning beds, mapping your moles, and monitoring your skin for unusual changes. Myth number 2. There's no point in quitting smoking. The damage is already done. The reality is that no matter how long you've been smoking, you still can reap significant health benefits by quitting. It's never too late to quit, but quitting today offers greater health perks than quitting later in life, especially if you're younger than age 50. People who stop smoking before age 50 cut by 50% their risk of dying early from smoking-related causes. And no matter how old you are when you quit, you'll reap these benefits. After a few months, improved circulation and lung functioning, less coughing and less shortness of breath. After 1 year, heart disease risk is just half of a smoker's. After 5 years, risk of cancers of the mouth, throat, food pipe and bladder is cut in half, and cervical cancer risk is the same as a non-smoker's. After 15 years, heart disease risk is about the same as that of a lifelong non-smoker. You can get tips to quit smoking by navigating our website. Myth number 3. Only women get breast cancer. The reality is that about 1 out of every 100 breast cancer cases occur in men. And due to a lack of awareness about male breast cancer, it's often found at later stages when the disease is harder to treat. Any man can develop breast cancer, but it's more common in men ages 60 to 70, as well as those with several female relatives who've had breast cancer, especially if those relatives have a genetic mutation. Also, men with cirrhosis, which is hardening of the liver, or men with diseases linked to high estrogen levels have increased risks of breast cancer. Also, breasts that have been exposed to radiation and/or inflammation or injury are also at increased risk, and also conditions associated with undescended testes or other conditions that reduce testicular function. Myth number 3. Nutritional supplements prevent cancer. The reality is that nutritional supplements don't reduce a person's chances of developing cancer. My advice is, if you eat lots of vegetables, fruits, whole grains, and beans, you should get the nutrients your body needs to lower your chances of getting diseases like cancer. Cancer-related checkups are vital to reduce your chances of getting cancer, especially later stage cancer. For people aged 20 or older, having periodic health exams, a cancer-related checkup, should include health counseling, and depending on a person's age and gender, exams for cancers of the breast, colon, thyroid, oral cavity, skin, lymph nodes, testes and prostate, ovaries, cervix, and uterus. Take control of your health and reduce your cancer risk by staying away from tobacco, staying at a healthy weight, get moving with regular physical activity, eating healthy with plenty of fruits and vegetables, limiting how much alcohol you drink, protecting your skin, knowing yourself, your family history, and your risks. Having regular checkups and cancer screening tests. Let's review some cancer screening guidelines. Cancer screening exams are medical tests done when you are healthy and you don't have any signs of illness. They help find cancer at its earliest stage, when the chances of curing the disease are the greatest. The exam you get and how often you are tested depends on whether you are at average, increased, or high risk for cancer. People at increased risk have a higher chance of getting cancer than those at average risk. It's important to know if people in your family have had cancer, and if so, what type. I recommend screening exams for the following types of cancer: breast cancer, cervical cancer, colorectal cancer, lung cancer, ovarian and endometrial cancer, prostate cancer, and skin cancer. For breast cancer screening in women, I recommend clinical breast exams every 3 years for women in their 20s and 30s, and every year for women 40 and over. Yearly mammograms starting at age 40 and continuing for as long as you are in good health. Women should know their breasts normally look like and feel like, and report any breast change promptly to their health care provider. Breast self-exam is recommended for women starting in their 20s. Some women, because of their family history, a genetic tendency, or certain other factors, should also be screened with MRI in addition to mammograms. Having one or more risks for breast cancer does not mean you will definitely get the disease. It means that you may be more likely to get breast cancer. If you are at increased risk for breast cancer, you may need to start screening exams at an earlier age, get additional tests, or be tested more often. Women who are at increased risk include those who have a family history of breast cancer, a history of radiation treatment to the chest, genetic mutations, or a history of lobular carcinoma in situ. For colorectal cancer screening, I recommend, beginning at age 40, for both men and women, should have colonoscopy every 5 years unless the previous colonoscopy is abnormal, such as a polyp. Then the colonoscopy should be performed every year. Men and women at increased risk have a higher chance of getting colorectal cancer than those at average risk. Men and women at increased risk include those who have a personal history of precancerous colon polyps, also known as adenomas, personal history or a family history of colorectal cancer, or a personal history or family history of inflammatory bowel disease. For cervical cancer screening, testing should begin at age 21. Women under age 21 should not be tested. Women between ages 21 and 29 should have a pap test every 3 years. Women older than 30 should have a pap test plus an HPV test every 3 years. A woman who has had her uterus removed and also her cervix for reasons not related to cervical cancer, and who has no history of cervical cancer or serious precancer, should not be tested. Women at increased risk for cervical cancer include those who have a history of cervical cancer or severe cervical dysplasia, HPV, which is human papillomavirus infection after age 30, an immune system that does not function properly, or has been infected with the human immunodeficiency virus, also called HIV, or DES exposure before birth. For endometrial cancer, also known as uterine cancer, screening, women should report any unexpected bleeding or spotting to their doctors. Some women, because of their history, may need to consider having an internal examination every 12 months, or a pelvic ultrasound every 12 months, or a yearly endometrial biopsy. For lung cancer, I do not recommend tests to screen for lung cancer in people who are at average risk of getting lung cancer. However, who should be screened for lung cancer? People who are current or former smokers between the ages of 55 and 74, or have a 30-pack year history of smoking or greater. There is a 20% reduction in lung cancer deaths among those screened yearly with CAT scans, and CAT scans can detect lung cancer at an early stage and reduce your risk of dying from the disease. For prostate cancer screening, men at risk for prostate cancer include those who have a family history of prostate cancer or those who are African American. Starting at age 50, men should talk to a doctor about the pros and cons of testing so they can decide if testing is the right choice for them. If they are African American or have a father, brother, or son who had prostate cancer before age 65, those men should have this talk with a doctor starting at age 45. If men decide to be tested, they should have the PSA blood test every year before their internal digital prostate exam. For skin cancer screening exams, persons at increased risk for skin cancer include those who have red or blonde hair, fair skin, freckles, and blue or light colored eyes. Those that live in sunny climates, have a family history of skin cancer, especially melanoma, have a personal history of skin cancer, or work around coal, tar, or arsenic compounds. Having damaged skin, such as a major burn or a scar, or have actinic keratosis, which is a precancerous condition of thick, scaly patches of skin. If you have a medical problem, or you or your loved one has been diagnosed with cancer, or has been injured because of a delay in diagnosing cancer, and you need guidance on what to do next or where to go for help, please call me. The toll-free number is 855-832-5757. The call is free. The advice is free. Just call the number and be sure to ask for me. Ask for Dr. C.